welcome back to Focus Atlanta. Thanks so much for continuing to watch. We are going to close out the show talking a little bit about congenital heart disease. I am here with Dr. Fundora. We're going to talk a little bit about how Congenital Heart Disease Awareness Week was just on the heels of that, how we as a community can know more.
Thanks for having me, Keisha.
Absolutely. Now, I got to say, when I think of congenital heart disease in children, I often feel like, it's one of those things where parents and communities feel like there's really nothing that they could do. Can we talk a little bit about whether or not there are things that we could do to help families in these situations?
Yeah, absolutely. I mean, congenital heart disease, what that really means is kids who are born with heart problems. I think that there's a lot of moms out there that when they're pregnant, they can go to their doctor, their OB, and if there's a worry or a suspicion about a heart problem, they can get referred to a fetal cardiologist, which is a cardiologist that specializes in growing babies. I think that for people who do know that their children have congenital heart disease, the important thing is to keep following up closely with their cardiologist and making sure that they're following all the recommendations. And then really and this is general advice for everybody, is to stay as heart healthy as possible. And that, of course, includes eating right and exercising and doing all those great things that we know are so important for the heart.
When we think about children, often, it's so terrible to think about them being sick at all, because they're, in our minds as adults, they're so helpless that they don't have, any control over any of this. But many of your patients, as they get older and they've learned to live with, these heart issues, are there things that we could teach them to do better, to keep themselves healthier?
Yeah, absolutely. Especially as, right now there's 2.5 million people in the United States who live with congenital heart disease. And actually, just as a testament to how advanced we're becoming and how good we are at taking care of them, so many of them are transitioning to becoming adults now. And so it's so important that, again, these things that I mentioned earlier about watching our weight, watching what we eat, making sure that we get plenty of exercise, that is even more important for people who have congenital heart disease as they're transitioning to becoming adults. The other nice thing, of course, living in a big city like Atlanta, is that we have groups that specialize in adult congenital heart disease. And it's definitely important that if, like every teenager, it's hard to get into the doctor's office. As these kids become teenagers and then young adults, as they start taking more responsibility for themselves, they really, really do need to follow up with one of these special adult congenital heart disease doctors and see them, especially if they haven't seen them in the last couple of years.
In closing, is there anything that patients and I guess families should know about whether or not this might be hereditary, whether or not this is something that, again, we hope that pregnant mothers are able to find it early, but often, if we don't really know what we're looking for, we don't ask the right questions. Is this something that if we've had a history in our family, we should be asking questions about?
Yeah, absolutely. I mean, if there is a family history of congenital heart disease, especially if mom or dad had congenital heart disease, or if there was a brother or sister with congenital heart disease, everybody, the other children, or if mom's pregnant, she should be seeing a cardiologist who specializes in fetuses or in fetal cardiology. I think that, in terms of genetics, we're learning so much. And again, it's just the beauty of living in a big city with so many resources. We're learning so much more about genetics and how that interacts with the heart. And yeah, there are certain genetic diseases that are associated with heart disease, but not all of them. And so we're learning so much more every day. But I would say the most important thing is that if there is a family history, if there is any suspicion, definitely, see a doctor, see a fetal cardiologist and a specialist, and learn more.
Thank you so much for your time today. We know that the Awareness Week is, 1 week a year, but it's a great time for us to have these discussions and let families know that we're out here and we're cheering for him every step of the way. It was good to meet you.
Yeah, it was great meeting you too. And, I of course, we give so much credit to also the wonderful nurses that we work with and everybody else that is really part of the team that goes into taking care of kids with all these complex heart problems.
Absolutely. The work that is done at Children's Healthcare of Atlanta is such a great value to the city. We're just happy to have you guys here, and we appreciate you. We appreciate your time today. Have a good one.
Thank you.
All right, guys, we closed out last week on Congenital Heart Disease Awareness Week, but that doesn't mean that it's just the one time that we can talk about it. Let's have these discussions more often. Learn more, visit the website. Thank you guys for tuning in to this week's episode of Focus Atlanta. I hope to see you next Sunday here on WUTA.